everyone, this is Hannah with Rocket Miner giving you another news update. Today I have several updates and stories that relate to COVID-19 that I wanted to go over just to see where we're at with that as a state and some of the most recent developments in our state's response. Today the Wyoming Department of Health is reporting that we have 17,442 confirmed cases and 3,037 probable cases. This is an increase of 924 since yesterday, which is a big number, but also with comparing to yesterday, we have to take into consideration that yesterday being Veterans Day, the normal reporting period of 24 hours was shortened. They reported the numbers earlier in the day than they normally do. So the numbers looked smaller yesterday and bigger today just because of that difference in when they were reported. It is still a pretty significant increase. It is definitely up today, but it does look a little more drastic just because of that change in the timing of the report. With yesterday's report, Sweetwater County was at the top of the list with the highest number of new cases at 18. Looks like today for Sweetwater County we've had 73 new cases. Again, those numbers feel a little more drastic because of the difference in the reporting time, but still the point is that in the state and locally we are still going up and seeing an increase, pretty drastic increase in some of our numbers. So today we have 8,767 active cases in Wyoming. This has gone up over the past couple of days quite a bit. So with that in mind, of that being where we're at as a state, there are several things going on and different conversations happening about how we're responding to COVID-19. Today we learned that the county health officers of Wyoming sent a letter to Governor Mark Gordon. The letter was sent on October 31st, and that letter is a request for a statewide mask mandate. The letter began with this explanation. They said, "During our county health officer calls on Thursday, October 22nd and 29th, 2020, all county health officers were united in recommending a statewide mask ordinance with the hope of preventing more death and disease from COVID-19 among our Wyoming citizens." The Wyoming Medical Society added its unified voice during its quarterly Board of Trustees meeting. They explained next in the letter that they know that right now where Wyoming's at is that different counties are individually requesting mask mandates. We've seen that happen. Several counties do have mask mandates right now, but they pointed out that if we're just going county by county, that's going to take a lot longer and it will not be implemented consistently across the state. So that was why they recommended that instead of going county by county, we just have one total statewide mask mandate for everyone. One of the other quotes from the letter said, "With the recent dramatic increase in cases and hospitalizations, expedited implementation is paramount. In addition, if we can slow the spread of COVID-19, we can hopefully also prevent another lockdown and speed our economic recovery." This letter was signed by 20 county health officers specifically. So that was sent to Governor Mark Gordon. Obviously we haven't heard a response yet, but that is what the county health officers are asking. As far as our hospitals go, the hospitalization number is up and continues to increase. As of today, the reported number is 192 COVID-19 patients who are currently hospitalized throughout Wyoming. This has gone up significantly in the last month. About a month ago, there were about 56 who were hospitalized throughout the state, so that, along with the cases, has continued to rise. And with that rise, there has been some concern about having enough staff at hospitals, having enough beds, just being able to respond to this increase in cases. The Wyoming Department of Health has partnered with the Wyoming Hospital Association to bring in some temporary medical personnel to address this surge and to prepare for any additional staffing needs that might come up. Because the Wyoming hospitals have seen this rise in cases, they have said that their main concern is to have adequate staffing to respond. And so in response, working with the Department of Health, the Hospital Association, Governor Mark Gordon is going to be using CARES Act funds. He's going to be using $10 million of those funds to bring in additional medical personnel to help with that strain on the hospitals and healthcare professionals, to bring in more people and staff to help respond to this surge. With the rise in cases, there has also been some problems in some places with contact tracing and just being able to keep up with that. So in some places, health officials are now asking people who test positive for COVID-19 to do their own contact tracing and notifications of telling the people that they've been in contact with. This was reported in a story from Douglas, and that was reporting an update from the Converse County Public Health Nurse Manager, Darcy Cowardin. She explained that as the Wyoming Department of Health started out, they were handling most of the contact tracing for the whole state. That started to be too overwhelming for the people that they had. They brought in 20 members of the Wyoming National Guard to help out with contact tracing, and it's still been not enough and just overwhelming for them to keep up with. So she explained that the Department of Health has contracted out the contact tracing to a private company who's going to be handling it. And one of the big changes is then this asking of, instead of them having to contact everyone that's been in contact with someone who tested positive, they're asking the people who test positive to reach out to the people that they've been in contact with. So that's one thing that is also being kind of overwhelmed with the surges and just harder to keep up with, is the different ways that people do the contact tracing. Hopefully people will actually be able to keep up with it enough to get it done, to let people be contacted, to know when they need to quarantine. Our state health officer, Dr. Alexia Harris, said that with this, they consider contact tracing to be one of the most important strategies, one of the most important things that they use to limit the progress of any virus, but especially with COVID-19. That's one of the most important ways to contain it and limit its spread. So it's something that needs to be done, but the people who have been doing it are being overwhelmed as there are more cases. So it's something that is struggling, and they're trying to find new ways to figure out how that can happen. So there are those updates. Also, Governor Mark Gordon is going to hold a media briefing tomorrow morning at 10 a.m. Usually his briefings are in the afternoon. This one's going to be in the morning. That will be streamed on Wyoming PBS television, as well as their Facebook and YouTube. And we will share that on our Facebook as well, so you can watch it from there. So we'll have to wait till tomorrow to see exactly what the governor says, but I'm sure he'll be addressing where we're at as a state with COVID-19 and any changes there might be going forward. So definitely listen in to that to hear his updates, and then we will report more on the updates from him tomorrow. So I wanted to make everyone aware of just those updates and things going on with COVID and where we're at right now. So thank you all for listening, and I hope that everyone has a good night.